My name is Dr. Thomas O'Loughlin, and I am a staff physician here at the San Joaquin Valley Rehabilitation Hospital. And I'm aiming to talk to you today about exercise, and specifically the effects of exercise on the heart, cardiac rehabilitation. Here at San Joaquin Valley Rehab, we're known as a hospital. Many think of us as a hospital for people with just paralysis, spinal cord injury, brain injury, orthopedic problems, limb loss, joint replacement, multiple fractures, and we do all of that. But an extremely important part of what we do is also cardiac rehabilitation. Many of our patients come to us with heart disease as well. In fact, one of the principal reasons that one of the biggest diagnoses in acute care hospitals is congestive heart failure and heart attacks, of course, one of our biggest issues. So we deal with that all the time, and one of the ways that, of course, that we deal with it in rehabilitation is with exercise, with physical therapy. And we have a team of therapists here at San Joaquin with physical therapy, occupational therapy, and of course the other ancillary professions of psychology, speech therapy, nursing, and so forth. But we're here to just talk about exercise specifically and the effects on the heart. The best way to approach the subject is to think of or explain what the effects of the lack of exercise are, because exercise then reverses those particular problems. And what's been found is that bed rest over time decreases the strength of the heart's contraction, and then the heart rate must go up in order to compensate for it. So that with every 1 week that a person spends in bed, their heart rate will go up by 10 beats per minute. So if you have a resting heart rate of 70 beats per minute, if you lay in bed for a whole week, your heart rate will go up to 80 beats per minute at the resting state. And of course, will go higher during exercise states in order to compensate for the weaker force of the heart's contraction. Now, contrapositively, if you exercise the heart muscle will then strengthen, and then the resting heart rate will come down. And it'll come down at about the same rate. A week or two is all you need to begin to recondition the heart. It begins happening right away. And you can strengthen the heart muscle just like you would any other muscle of the body. So exercise puts a demand on the heart, even sitting up. So we get our patients up out of bed and sitting up and upright as much as possible, because just the contraction of the heart to push blood against gravity is exercise in and of itself. And the more that we do that, the more that we get up and about, the more the heart conditions, the stronger the heart contraction is, and then that begins to lower the heart rate because you can pump more blood more efficiently with fewer beats per minute. Then your heart rate begins to come back down. This is why athletes will have heart rates frequently in the 50s or low 60s, because their hearts are so conditioned that the strength of each contraction of the heart is so strong that they don't need as many contractions to circulate the blood throughout the organs. And it also raises the question about, well, what if your heart's been damaged? What if you have a heart condition? And you always want to check with your primary care physician regarding this, and your cardiologist if you have one, to determine how exercise would affect your heart individually. But when we receive patients in rehab at the San Joaquin Valley Rehab Hospital, they have gone through acute care hospitalization, and the condition of their heart has been either damaged by a heart attack or has been affected by stroke, by surgery, or they've had an intervention, surgical placement of stents, for instance, to open up the blood vessels, and then they're fixed, so to speak, but with a reduced or a damaged state, and they come to us, and we then enlist cardiac exercises to improve their cardiac function. And the same things apply to a diseased heart as they do to a healthy heart, that exercise has the same beneficial effects. It increases the strength of heart's contraction, does the same thing to heart rate that I just explained, and it also helps to lower blood pressure. It has all the other beneficial effects of changing your lipid profile, reducing cholesterol in your blood, thereby decreasing the clogging and atherosclerotic disease in the arteries. And it does many other favorable things in addition to cardiovascular, brain health in addition. So those are some basics of cardiac exercise, of exercise in general and its effects on the heart. And do discuss these issues with your doctor and make exercise a regular program for you to keep your blood pressure low, keep your cholesterol, and therefore your cardiovascular health in check with a regular exercise program. These are just among the few reasons that doctors are constantly bashing on on exercise and dieting in terms of taking care of your general health, in particular your heart health. Thank you very much for listening. I'm Thomas O'Loughlin at the San Joaquin Valley Rehabilitation Hospital.